Eleanor. I've asked my friends to take you on a tour of the University of Vermont Children's Hospital, a full-service children's hospital housed within the University of Vermont Medical Center. They know firsthand how important a hospital is because they care for patients just like me. The UVM Children's Hospital is here because lots of caring people want to dedicate their lives to helping children feel better. Each year, they care for more than 51,000 patients. That's a lot of help for kids. Everyone who works at our children's hospital knows that kids experience things differently than adults. With help from generous community members like you, they're able to make sure the hospital is child-friendly and family-centered. My friends will show you some of the areas of the children's hospital, but there are lots of other places that help our kids grow up healthier. Enjoy the tour!
Hi, I'm Emma. Let's take a look around the Children's Specialty Center. We'll call it the CSC for short. I come to the CSC every 3 months because I have type 1 diabetes and celiac disease. The waiting area has a special play area with toys, computers, and activities like Art from the Heart. People here are really nice and are here to help you, like my favorite nurse Lisa and my nutritionist Allison. The amazing doctors and nurses here care for kids with all kinds of sicknesses or injuries, like in their hearts, lungs, brains, livers, and more.
Hi everybody, I'm Sawyer. This is the infusion bay where I went to get my treatments when I had leukemia. I come here every other month to make sure I don't get leukemia again. I visited over 80 times. That means I get to call myself an expert. My favorite part of my visits is when the child life specialist brings me things to do like arts and crafts and games to play. People who give money to the UVM Children's Hospital help purchase art supplies and things like this distraction unit. Fun activities help take kids' minds off of not fun things like needles and being away from home. When you finish with your final treatment, you get to celebrate by ringing this bell.
Hi, I'm Maria. I come to the UVM Children's Hospital because my kidneys don't look like other kids, and I have to get a lot of blood drawn in the lab. When this space was being built, Children's Hospital kids and families were included in the process to make sure it was kid-friendly. Here's the waiting area just for kids. Now let's check out one of the blood draw rooms. I love the extra large chairs so I can sit on my mom's lap. They also have these curtains to cover up all the needles and stuff. The people here are great and they even let you pick out a pretty band-aid at the end.
Hi, I'm Noah. I'm 13 years old. I visit the UVM Children's Hospital a lot. I come here for appointments, tests, x-rays, ultrasounds, lab work, and surgeries. Surgery means having part of you fixed by a doctor. One stop I make is pre-op. Let's take a look. Pre-op is a busy place. This is where my favorite anesthesiologists, Dr. Stebbins and Sierra from Child Life, visit me. Sierra brings me cool things to do and gives me lots of choices, like letting me pick the scent of my mask and letting me decide what to do to keep busy before surgery begins. Sierra is awesome, and getting surgery is so much better when she's there. Did you know that donations to the UVM Children's Hospital help to make sure Sierra has everything she needs to take extra special care of patients like me? Donations help child life in other hospital areas too. There are other doctors, nurses in pre-op too. They answer all of my questions and my mom's questions. Everyone is kind, friendly, and funny. They take really good care of me and my family. And I know if you ever have to visit the UVM Children's Hospital, they'll take great care of your family too.
name is Finn, and I'm here to show you the Pediatric Intensive Care Unit. Around here, we call it the PICU. I know this because I spent 50 days in the Children's Hospital after my bike accident. The PICU takes care of kids who are really sick or injured like I was. My doctors, nurses, and specialists did everything they could to help me get well and back to riding my bike. My spleen was ruptured, so they had to watch my heart rate, breathing, and blood pressure closely. Some kids need a breathing machine like this, called a ventilator, or they have to take medication that means they need to be watched around the clock. Here's a picture of me when I was in the PICU. Can you believe that's me? I still remember the little things that made my hospital stay better. Awesome nurses, unlimited use of an Xbox, and tons of people came to visit me. I won't lie, being in the PICU was hard, but I made it through with lots of care and support.
Hi, my name is Austin. This is my twin sister, Bailey. We are going to show you around the neonatal intensive care unit, also known as the NICU.
My brother and I were born 12 weeks premature and had to stay there for a very long time. I was here 75 days and Austin had to stay 78 days.
She beat me by 3 days.
Each year, the NICU cares for more than 600 babies who are either sick or born really, really early. There is a lot of very important equipment in the NICU. Every piece helps babies get stronger and healthier. When people give to the UVM Children's Hospital, they're helping to buy equipment like the strap isolette, which makes it easier to care for the babies and helps them feel more safe.
A lot of grown-ups work in the NICU, doctors, nurses, specialists. Everyone in the NICU is kind and caring and loves the babies, but wants them to feel better so they can go home.
They also help take care of the families. When we were in the NICU, they gave our mommy and daddy hugs, gas cards, parking passes,
And food,
Thanks for helping the NICU take care of special babies.
just like us.
Hi, my name is Kosin, and I'm going to show you around the University of Vermont Children's Hospital Inpatient Unit. Around here, it's called Bird 5. I know a lot about this hospital because I've stayed here for many days and had 2 surgeries. When you stay over at the hospital, they make sure there are lots of things to do. I got to make teddy bears, paper airplanes, and play music on different instruments in the playroom. There are also cool things in the mastermind team room. Check out the TVs. There are video games, art, and lots of activities that help kids of all ages feel better. I got to pet dogs just like Molly. Donations to the UVM Children's Hospital help make all this possible. Here's the place moms and dads can shower and do laundry and sleep overnight. Everyone works hard to help kids feel better, have fun, and heal so they can get back to just being kids.
Hi again. I hope you enjoyed the tour. I also hope you learned how your donations help keep expert pediatric care close to home and help kids like us grow up happier and healthier. See you around.